was in the emergency room when a male patient, despite multiple reassurances and clear instructions, kept insisting on a general examination. It was both degrading and demoralizing. Another time, a senior recalled an incident when one night after a particularly tense shift, one of the angry patient attendants followed her back to the residence hostel. She had to hide in a friend's room and call for help, her heart pounding with fear. The realization that we aren't safe, even in what should be a refuge, was a terrifying reality to accept. The crisis doctors like me face every day is not the shortage of medicines or lack of equipment. It's the unspoken suffering that I, along with countless other trainee doctors, endure in a system meant to nurture us. More than 70% of healthcare providers in India have faced violence at work. The mob in the emergency room, a violent relative of the patient, violent threats on the phone, and the endless jibes on social media. I echo the sentiments of my colleagues when I say that every time a doctor endures abuse in silence, a piece of their spirit is chipped away. The trauma that we carry from witnessing death, disease, and the gruesome reality of our work is compounded by the abuse that we endure. We may wear a mask of professional resilience, but behind it lies a deeply unacknowledged trauma that festers beneath the surface. The recent tragic death of a postgraduate trainee at the Arjekar Medical College and Hospital in Kolkata has cast a harsh spotlight on the systemic failures plaguing our medical institutions. Each time that I find myself sprinting between floors at 2 a.m. on a night shift in the hospital, the unsettling quiet, the loneliness, and the creeping unease all feed into an overwhelming sense of fear. I try to brush them off, convincing myself that it is just hypervigilance, a burden women are often conditioned to develop. But now, I think of the young doctor from Kolkata. Did she also dismiss that gnawing fear before her worst nightmares came true? The term resident doctor originated in the 19th century when medical trainees began living in hospitals as part of their training. Today, the tradition of long, grueling shifts continues, with doctors often working up to 36 to 48 hours straight. The continued enforcement of such demanding schedules raise critical questions about whether this outdated model of training truly benefits modern medicine or merely perpetuates a legacy of exhaustion and unrelenting pressure. In many Indian institutions, the basic requirement of residency, a place to rest, is not guaranteed. Some hospitals don't even have proper rooms for us to reside in during those hectic nights. But we do. I'm not alone. Many women work night shifts at hospitals. Doctors, nurses, lab technicians, janitors. Expecting doctors to work in unsafe conditions while bearing the brunt of patient fury is tantamount to asking them to sacrifice their well-being on the altar of medical duty. While the conversation about exempting female doctors from night shifts has begun, is this really a solution to the ongoing problems we face? Wouldn't this deprive us of the training that we require as resident doctors? Are crimes against doctors and women not occurring in broad daylight? Instead of creating safe spaces, we're further limiting women healthcare providers in their workplaces. Our fight isn't just for better working conditions, it's for a system that acknowledges our humanity. When we are dehumanized and pushed to our limits, it's not just us who suffer. The entire healthcare system falters, and ultimately our patients pay the price.